Well, hello, everybody out there. Welcome again to the Start or Sit podcast. This is a discussion we have regarding injuries in the NFL, fantasy football players, particularly speaking here. Are they going to sit? Are they going to start? What's going to happen? Joining me, as always, is Dr. Hawkins, who is going to describe this injury, talk about return to play, maybe any type of intervention. And anyway, we're looking at start or sit. First player up, Buffalo Bills. This is a big name, big name here, Josh Allen. What is going on here?
Yeah, it sounds like he basically ended up, they described it as a foot sprain. He went down, was kind of tackled, kind of landed a bit awkwardly, and he was able to continue, but when he came out to his press conference afterwards, they had him in a walking boot. The description of a foot sprain, since he was actually walking on it, that's a good sign. That tells us it's probably not that Lisfranc injury that we've touched on before. Lisfranc, it describes an injury that's in the middle of your foot, kind of on the big toe side of the foot. And that's an injury that was described a lot of years ago when someone was riding a horse and they would actually fall forward and have their foot caught in the stirrup. And that would disrupt the ligaments on that inside middle of the foot. So anyway, those Lisfranc injuries, those are the ones we hear about and the player's done. But that generally he wouldn't be walking on that. So this is probably a sprain on the outside half of the foot, the lateral side of the foot, which inherently is more mobile. And so the ligaments over there have more play in them. And so you typically will stretch a ligament over there. And it's a pain generator. They want to, try to avoid the bending and twisting on it. So they'll put him in a boot to rest him for his walking activities. But it looks good that he's obviously not going to miss any time, not going to need anything surgically for it. And so he should be playing this week.
Yeah, I mean, that's a great description. I mean, real quick, it's interesting. Lisfranc, when you describe it as falling out of the stirrups, I believe the injury was named after Lisfranc, who was a physician in Napoleon's army, and noticed that these riders would have this foot injury when they fell out of their saddle. Is that correct? Do I remember that right?
Yeah, absolutely. You always impress. Yeah, that's exactly it. And we get a little history session in the middle of the podcast too. But that's exactly it.
That's right. I love history. Josh Allen is likely playing this weekend, and the Buffalo Bills need him. He is a great quarterback. Another quarterback, Chicago Bears, Justin Fields. Boy, a lot of stuff going on here. Looks like cracked ribs. Maybe a left hand. There's a lot of stuff going on. This guy's getting sacked. I think he's getting hit a lot. Yeah.
You're seeing that classic situation. A young quarterback, a guy that they like his mobility, though he's not a running quarterback. And so he goes out and does try to get some things done on his feet. He's not quite Kyler Murray. And he's starting to show some of the wear and tear of doing that on a team that's not really good at protecting him. So he was already battling the rib issue, was trying to play through that this past week, and then had, essentially a hand contusion. So we're not talking the Russell Wilson style injury. I wouldn't be surprised if it was one of those situations where he got hit by a helmet during a tackle, when somebody was bringing him down, and they tested him. It's his left hand. He's going to be able to play. It may affect a little bit as far as like how he handles the ball. So he may, if he's your starting quarterback, you're in fantasy playoffs now. It's a wing and a prayer with him right now, whether he's gonna get you the points you need, but he is going to play.
Justin Fields, start. Tell me, Dr. Hawkins, I mean, you're talking about cracked ribs, 2 cracked ribs. I mean, he may play. He's going to have protection over those ribs. But if he takes a good hit to those ribs, that is super painful. I mean, is he one hit away from being on the bench just from pain and lack of ability to play from just not being able to function?
Yeah, I think if he's, the quarterbacks have gotten a little smarter now with regards to avoiding injury as much as they can, and the rules have changed so those defensive ends can't come in and bear hug you and land on you unless they get a 15-yard penalty. Yeah. So that's going to be to his benefit. Again, I think you're exactly right in being worried that he may end up out of the game early on if he does take one of those hits. But I don't think they have a great option otherwise. I think Andy Dalton's still battling some other stuff as well.
Yeah. Yeah, we talked, I think, last podcast we were chatting about just kind of the repetition, the continuous contact. Here we are, week 15, and multiple injuries. Players are getting beat up. I mean, it's just common. It's a contact sport. Here we got Giovani Bernard, Tampa Bay Buccaneers running back. He has, again, one of these injuries, multiple injuries, hip and knee. And, I don't know. I don't know if he's going to be playing with those. What do you think?
Well, he's a classic, running back. So he's been around a while. He's got some mileage on him. He had a number of years as a Cincinnati Bengal. Some people even thought he was out of the league because he'd kind of dropped off with his production. So he's had some resurgence being able to come down there with the Buccaneers. They've kind of got these players that have come from other teams and are taking a partial role. So they've been able to share the ball better. But you're exactly right. He ended up with two issues. He has, what they've described as a strained hip, which we've talked before. It's probably something related to those muscles that cross the hip joint, help to stabilize it. And then in addition to that, he sprained his MCL. So the big thick ligament on the inside half of his knee was sprained. So because they use a few different running backs down there, they've just decided to put him on IR. They're going to be in the playoffs. They're probably going to be one of the number one seeds, and he will not play this week. But I think the reason for putting him on IR is to know that, he won't play at all for 2 to 3 games. And then, hopefully they'll get him back and he can be, 15, 20% of their running back load going into the end of the playoffs.
Yeah, these teams, as you go into the playoffs, again, this is a sport of contact and repetitive contact over 16, 17, 18 weeks. I think any team needs 3 or 4 running backs when you go in the playoff. You need options. That's probably what they're saving him for. So he is sitting for at least 2 to 3 weeks. Okay, DJ Moore, Carolina Panthers wide receiver. He is day-to-day, again, one of these hamstring injuries, kind of that strained hamstring. Talk about that.
Yeah, that's that classic injury where the muscle itself has had some degree of a tear or a pull. So we're talking about the middle of the muscle, not the end of it. So the end is the tendon that attaches to the bone. So if you have a hamstring avulsion injury where it's pulled off the bone, that's a surgical problem at a athlete of this level. So the vast majority, it's like the sprinter who pulls up in the middle of a 100-meter race holding the back of his thigh. He's caused some tear in the muscle that causes swelling. It causes inflammation. It causes tightness. So an individual like him, he's going to be, deeply involved with his training staff and his therapist. And this is going to be one where if he can show that he can move well in his, pre-game routine, he will probably play.
Yeah. I don't even know. Is Carolina... Do you know what their position is? Are they playoff bound, wild card? Where are they at?
No, I don't think that. They may theoretically have that ability that if everybody in front of them collapses and they win out, that they could sneak in at the edge. But they're not really considered in the playoff picture right now.
Yeah, that's what I thought. So that for that reason, he is going to sit. Then you think?
No, I think they'll try to warm him up, and if he can move, they'll play him.
All right, they'll get him out there, take him through some exercises, some drills. If he can cut, stop, start, twist, turn, all that neat stuff, they'll play him. That's DJ Moore, Carolina Panthers. All right, here's a big name for the Las Vegas Raiders, Darren Waller. He's got a lot going on. Knee, back. He missed some games. Is he coming back or is he sitting still?
He's going to be that opposite situation where, they do have that opportunity to show well and get into the playoffs. And I think they were trying to kind of, do what happened with Bernard. I think they sat him more than you would expect between the last few games to try to get him primed up because of all these wear and tear issues coming on. But he does not have any major structural issue. They're all sort of overuse problems. The knee injury was classified as a little bit of an iliotibial band problem when he went out with it a week or two ago. And so he'll play, and I think they've been cautious with him to this point so that hopefully he can produce so that they can get a good seed moving into the playoffs.
Yeah, he's a pretty important part of their offense. Darren Waller is playing, most likely playing. Hey, as we wrap up here, I want to talk to you about, just because I'm a big Coug fan, go Cougs, Washington State Cougs there. We have a guy named Gardner Minshew. He took over and started last week, I believe, for the Philadelphia Eagles, led them to a win, a couple touchdown passes, but he replaced Jalen Hurts, and Jalen has some interesting stuff going on. Is Jalen back, you think?
Yeah, he was on track to come back. He obviously sat a week, then they had a bye week, so he had 2 weeks off, being treated for an ankle, and apparently he had gotten to the point where he was starting to do some impact live activity. They weren't doing like training in a pool or a water setting, and it sounds like his progress slowed a little bit. So I think the hope is that for the Eagles, they're hoping that he can play. However, in support of your Cougar alum, Gardner had a good game, and I spent a lot of years in Philadelphia, and my brother-in-law basically came back after that. Gardner had that great showing and said, "Yep, it's just about time that the Eagles have a quarterback controversy. We're about that time in the season." So there's people in Philadelphia that kind of say, "Hey, Gardner played really well. Let's play him now," because Jalen was doing okay, but he wasn't lighting anything on fire. So, the long-winded answer is, I think their goal is Jalen will play, but they're going against the Washington football team. I think they're expecting it's going to be an easy game. And so I think that he may start, but they may sit him if the game gets out of hand, and put Gardner in.
Okay, so Jalen Hurts gonna start, but could sit to get some rest if the game is going well. That's what you're saying.
Correct.
Okay.
Yeah.
All right. Hey, as we wrap up here, boy, I tell you, once again, that was good stuff. But I got to ask you, you said you're from Pennsylvania. I mean, you talk about your brother-in-law having tickets to the Philadelphia Eagles. Is that right?
He doesn't directly, but yeah, I do have some good friends that do have, do go get to every game.
Have you ever been to an Eagles game in the stadium there?
Yes.
Oh my gosh!
Yeah, and I've been to some bad ones. I've been to the one where they got knocked out right before the Super Bowl and lost to the Panthers. So I've been to some bad ones.
It's a bucket list thing for me, is to go to that stadium, and I'm going to try to wear a Cowboys uniform. Is that a good idea?
Yeah, not a good idea. Yeah, Philadelphia is particularly tough on things like that.
Dr. Hawkins, thank you again for your time. This has been a pleasure. Can't wait to talk next week. Have a good day.
All right. Thanks, Shannon. You too.